We have worked with several partners to try and identify in a systematic way and in a rigorous way the communities and neighbourhoods where community social paediatric centres could have the greatest impact possible. I'm going to talk about the approach that we've adopted, and then we'll look at some general findings, and then Tonino will take over and look in more detail at this and say, and now what? And I think that this is a nice vignette that links into what Dr. Sharon Goldfeld has just presented, and that will be a nice segue to the rest of the morning. So first of all, I'm going to talk about the project, and then we're going to talk about possible repercussions of this. The main objective, as has been mentioned, was to identify the most at-risk or most vulnerable communities defined according to different concentrations of risk at different levels. It was interesting when we saw the cloud of words. There were lots of words that came up, and in the committee and in our meetings with the different partners and different ministerial departments and the universities in Tonino, we came up with all of these words, and in an ideal world we would have loved to have been able to capture certain other measures of had more feedback on each of these different concepts, each of these words. But of course sometimes we're overtaken by reality. We can't always achieve everything that we want to achieve, but it's true that all of these words that were up on the screen were part and parcel of our discussions. We have to point out that we didn't have much time to do this, and there were several partners involved from the provincial government. There were different ministerial departments that were involved. There's people in the room today with us, and I'd like to thank Marie-Josée La Rochelle, who was present, who was part of the committee. There's perhaps others in the room. I haven't been able to meet with everyone. There were people from the family department, from the social services department, the education, the labour, employment and solidarity department as well. We tried to amalgamate the data that was collected from lots of different areas, and sometimes that was really successful, and sometimes there were a few more challenges encountered. And of course we had our partners from the Dr. Julien Fondation and the Université de Montréal, as well as McGill University. With this approach we needed quite specialized technical methodological resources. When I looked at the presentation from Dr. Goldfeld, we saw that it's very important to have associations with people from different environments and to broaden our horizon. That's what we've started to do with this approach, turning to people who deal more on the geography side of things or who are specialized in geomapping. Otherwise, it wouldn't have been possible to do all of this. And finally, we needed to have quick access to data. We wanted to be able to present all of this here at the symposium, so time was ticking. We tried to work as effectively and efficiently as possible, but at the same time we wanted to be rigorous and systematic in our approach. So now the approach itself. First of all, we had to ask ourselves what we're talking about when we refer to vulnerability. If a child is living in a neighbourhood which is more at risk according to our common agreed language, does that mean that that child is necessarily at risk? I think we can all say in the room that the answer is no. Dr. Goldfeld was asking this question: what means that this child who seems to be in a so-called vulnerable or difficult neighbourhood actually succeeds very well? And if, on the other hand, you live in an environment which is less at risk, does that necessarily mean that it's going to always protect you? It's not cast in steel. So we had to think about all of this. And then there was this question of what really is a community, what is a neighbourhood. We know that social paediatrics really works neighbourhood by neighbourhood. We're set up in neighbourhoods and we want to have easy access. We want families to be able to walk to our centres, but how do we define this type of community? Is it just a matter of geographical frontiers, or do we need to look at the adjacent neighbourhoods as well? That was the first stage in our work, which led us to say, right, what are we going to focus on, and what are going to be the risk indicators on which we're going to concentrate our energies? Then we had to look at what was accessible in terms of data. We really wanted to concentrate on the smallest geographical territories possible, but the way in which the data are organised within different departments meant that we couldn't always work at this scale. Sometimes it was at the level of the CLSC, the local health clinics, or sometimes it was at a finer detail level. So how could we actually merge all of these data together without losing anything in terms of being accurate and rigorous in our analyses? We finally decided to go for a territorial geographical scale at the level of the CLSCs, and you could see that for certain indicators we were able to go into even more detail, but in general, if you've been able to consult the report, you'll see that's been our approach. It's on the website of the Dr. Julien Foundation, but in general we've stuck to the CLSC level, and we've got 3 indicators. There's one indicator on socio-economic underprivileged districts. I'll talk about that in more detail, and another indicator was looking at the schooling of their children, where there were delays, for example, at elementary level, and then school dropouts at the secondary school level. Then finally, we also looked at data that related to the concentration of services at the level of the CLAC related to child welfare. These data are not publicly available for various reasons. These are data which are very sensitive, and these are data that we want to share, first of all, with the directors of child welfare and the youth protection services in Quebec. And just one small nuance, when it comes to this socio-economic disadvantaged factor, using the census data, we're able to go to a lower scale in terms of the areas of distribution. So this gives us data for geographical areas. We were talking about 400 to 700 people grouped together, so that's at a finer level of detail compared to the CLSC level. I'm not going to go into all of the nitty-gritty here because I want to give the opportunity to my colleague to talk about this. But in fact, for each of the indicators, you've got the indicators that were used to compile the indexes. We're not going to go into all of the details. We can answer your questions later in this session. But there you've got the details for each of the indexes as to what is actually included. We had to make some choices, of course. If there's specific questions, we can answer them. We couldn't include everything. Certain indicators had already been used in other work, but for example, when it comes to the socioeconomic underprivileged index, we really wanted to target families, because you will understand that that's what's important when we're talking about social pediatrics. We want to concentrate on children and families. So that meant that we needed to have an index that would reflect that particular reality, and that had a great influence on our decision to actually come up with our own vulnerability indexes or indicators. Turning now to the analysis and interpretation, what did this produce? In terms of socio-economic underprivileged factor, we were able to put all of this in order, and this relates into what I said about La Presse article. This is not a ranking of the different districts and neighbourhoods. That's not how we should actually interpret this, even though we realised that there was this risk that people would interpret it like a ranking system. But rather, the idea was to locate the different neighbourhoods to get an idea of the most at-risk neighbourhoods. But it doesn't mean that the neighbourhood that's in position 27 compared to the neighbourhood that comes down at number 30 is much worse, or the first compared to the 20th. It's just to give us an idea of the risks and the vulnerabilities that exist in each of these neighbourhoods. So basically, we were able to establish quintiles. We've ranked these from the neighbourhoods that are the most vulnerable, if you like. And even we're trying to explain this, it kind of communicates this idea of having a ranking, but we're talking about the concentration of risk. So we've given an order of all of this in terms of quintiles, and then when it comes to dropping out of high school and delays in elementary school, we look at proportions and rates, and we compared it with the provincial averages. So in certain territories, CLSC territories, what's happening in terms of delays or dropouts in school? Are they higher or lower than the provincial average? That was the approach there. Same thing for the concentration of the youth protection child welfare services. We were able to list them in terms of the quintiles of vulnerability. We looked at different aspects as well in terms of population density in the different territories, immigration as well, because in and of themselves these factors are not risk factors, but it does give a certain colour, if you like, or flavour to a neighbourhood. So that has to be taken into account in particular for a subsequent approach or stage where we may try and organise this with a more qualitative lens. There are certain elements as well, or certain indicator categories that we had to drop because the data that were available didn't allow us to go into more in-depth analysis. For example, everything related to mental health and physical health, and also the expenditure that's carried out to provide these health and social services. Now, that doesn't mean that these are not interesting elements to be explored. It's just that we weren't able to match all of that up with the type of analysis that we wanted to achieve. And I'm going to show you this map, and then I'm going to give the floor to Tonino. This map gives you an idea of what we were doing with the socioeconomic underprivileged districts indicator. You've got the explanations on the side. When it's darker purple, you've got more at-risk neighbourhoods, and then we gradually go down the colours like that from the most at risk to the least at risk neighbourhoods.